everybody, it's Jenny from MedEd again, your CNA instructor. So the next procedure I'm going to go over with you is how to give a bed bath and do perineal care. Now, this skill for your state test is quite long. There's 35 steps, but I have confidence that if you watch the video and practice with me, if you get that as a state test procedure, you're going to pass it just fine. So we start by getting a report from our nurse. We're going to ask about our resident's needs, abilities, and limitations. I've gotten a report. My resident's name is Annie, and she's requesting a bed bath. I've knocked on the door, requested permission to come in. I've identified myself by name and title. I've called my resident by the name they prefer, and I've explained what I'm going to do. I've found and gathered my supplies. I've provided for privacy by closing the curtain drapes and doors. I'm going to wash my hands, wear gloves when dealing with body fluids, and I'm going to use good body mechanics. So before beginning a bed bath, the very first thing you want to do is offer them the bedpan or the urinal. This is a very long procedure, and we don't want to cause embarrassment if they have to go. My Annie has said no, she does not need it. So to put my resident in the proper position, I'm going to place the bed in supine. I'm going to put my side rails up, and then I'm going to bring my bed up to a workable height. You want it about at your waist. And then I'm going to lower the side rail on the side I'm standing on. Next, I'm going to drape my resident for privacy. I've got my bath blanket. I'm going to unfold it on top of the top sheet and blanket. I'm going to request my resident hold it, or I can tuck it under their shoulders. Reach under the bath blanket, roll your sheet and blanket down to the foot of the bed. We're going to keep her body covered, but not get the sheets and the blankets wet. Next, I'm going to fill my bath basin halfway full of warm water. I'm going to check it, then I'm going to let the resident check it. I'm going to put on my gloves. And I'm going to check them for rips, holes, and tears. And if I found any, I would replace them. Now, the easiest way to keep control of your washcloth so you have clean and dirty areas is to wrap it like a mitt. So to do that, hold your washcloth between your thumb and finger, wrap it behind your fingers, and then fold it towards you. And now we have control over our washcloth, clean and dirty areas. We can move it as needed. So when giving a bed bath, the first thing you want to wash are the eyes. So get your washcloth wet, one corner for one eye, one corner for the other eye. So the eyes, start with the inner corner out, other side, inner corner out. Pat dry. Apply soap if requested, and we're going to wash the face, the neck, the ears, and behind the ears. Pat dry. I'm going to remove her gown under the drape, roll it to the foot of the bed. And now again, I have a mannequin, but for your state test, you're probably gonna have your instructor or somebody in the bed, so they'll be able to move their arms for you. Take it, roll it down to the foot. Place it at the foot of the bed. And we're gonna lean over the resident and wash the farthest arm first. We're washing from cleanest to dirtiest. This is gonna be our dirtiest spot. And the reason we're doing that is because we don't wanna run back and forth, back and forth, back and forth. So wash from farthest to closest, cleanest to dirtiest. Towel goes under the far arm. And that's gonna prevent your bedding from getting wet. Take your washcloth. You want to start at the fingertips and work in. So I'm going to wash the hand, arm, shoulder, and armpit. I'm going to rinse, same direction. Hand, arm, shoulder, armpit. And then I'm going to pat dry. Hand, arm, shoulder, and armpit. Making sure that armpit's very, very dry. That's a friction area. They get a lot of skin breakdown there. I'm going to take the towel off of this arm. And I'm going to repeat with the arm closest to me. Towel under. Soapy washcloth. Hand, arm, shoulder, armpit wash. Rinse. And then pat dry. Again, making sure that armpit's very dry. You don't want to expose your resident, so to wash the chest and abdomen, take the towel, place it over the chest and abdomen. Lower the bath blanket to the edge of the towel. Soapy washcloth. Lift the towel, wash the chest and abdomen, getting all up in the skin fold. We're going to rinse the chest and abdomen. And then pat dry the chest and abdomen. Making sure under the breasts, skin folds are dry. Again, those skin on skin areas. Bring the bath blanket up over the towel. Remove the towel. And we're going to go down to the legs. Do the legs just like the arms, farthest to closest. Uncover the far leg. Place a towel under the far leg. Take your soapy washcloth. And for the legs, we work from the thigh down to the foot, in between the toes. So we're going to wash the leg, we're going to wash the foot, in between the toes. Rinse, same direction, leg, down to the foot, in between the toes. And we're going to pat dry. Leg, down to the foot, and in between the toes. Making sure in between those toes are very dry. Again, skin on skin. Take the towel from the far leg. And repeat the steps with the leg closest to you. soapy washcloth, wash, leg, foot, in between the toes. Rinse, leg, foot, in between the toes. And dry, leg, foot, in between the toes. After the feet, this is what we call, when I teach, big change number 1. So I'm going to do this for you one big time, that way you can see what I'm talking about. But after the feet, we want to change and get all new stuff. So I'm going to get rid of my washcloths and towels, put in my little linen bag here at the foot of the bed. I'm going to get rid of the water. I'm going to take off my gloves. I'm going to wash my hands and get new stuff to do perineal care. So I'm going to grab some clean towels, clean washcloths, clean water, halfway full, have the resident check for comfort, and new gloves. Now, most of the testers that I've been working with at this point, you just have to say that you're getting all new stuff. I did want to go over it though with you so you could kind of see what I was talking about. But at this point for the test, they usually just wanted to hear you say that you're changing your gloves, washing your hands, getting clean towels, clean washcloths, clean water. And then they usually say, okay, keep going. If your resident is able, assist them to bend their knees and spread their legs. And Annie does it kind of well. And you want to kind of drape your drape like so. This way you can kind of lift up to your perineal care, but if somebody that you don't want in the room just comes walking in, because that does happen, we can just quickly drop that drape and keep our resident covered as we ask them to politely leave the room. So that's kind of how we drape the resident to do our perineal care. Now, if your resident has a catheter, which is that tube that comes out of the urethra to drain urine from the bladder, if they have a catheter, check for leaks, secretions, or irritation. So there should